Jen, how are you?
Hi, Tracy. I'm hanging in. How are you?
Great. Me too, doing the same. So today's topic is allergies. We're going to get a little bit more in depth with that.
So many people have allergies acting up at this time. We're all so paranoid about our health that as soon as you start to get a sniffle, you get probably even more concerned than you have in the past. So we're going to give you a few tips on how to deal with allergies. First tip, dairy tends to make you phlegmier. So if you have a lot of congestion going on, try to eliminate or at least cut down on the dairy products in your diet. Another trick is, and it's so simple, but ginger tea. One of my favorite brands is Traditional Medicinals. Ginger really helps open you up, and it's anti-inflammatory. It can even help with headaches, and it helps with digestion. You add some lemon in for vitamin C, and then raw honey. If you get the raw honey, preferably either get locally sourced raw honey, or if you want to spend a little extra, Manuka honey is very powerful. But the point is, honey has antibacterial, antimicrobial properties, and it soothes the throat. Tracy, you want to talk about the gut?
Yes, yeah.
Okay.
I wanted to add a little bit more insight on chronic allergies. I know a lot of us deal with seasonal allergies, but there's a good percentage of us that have chronic allergies all the time. So one source of what's going on is your immune system could be either on hyperdrive or it could be very suppressed, right? So getting a little bit more information about what's going on with your immune system can be really great by doing a comprehensive gut test. Do you have enough good bacteria? Do you have bad bacteria in there that might be a contributing factor to these chronic allergies? And that's something that we do in our clinic.
What kind of test do people take at your clinic?
So we test for yeast, which could be another source of allergens. We test for good bacteria. What type of good bacteria do you have in there? Is there enough? We test for dysbiotic or bad bacteria, and also knowing what different types of bad bacteria there are and what symptoms they can cause. And we also look at the health, the lining of your gut. So sometimes people have very inflamed gut linings or it's very weak. And these can all be signs of leaky gut, which we hear a lot about today. And then we can test for things like pH, parasites. So those are the most common.
And are
things.
these mostly like fecal and blood tests?
This particular test is a stool test that you would do at home. You don't do it in our clinic, but we give you a nice kit and all the directions of how to do that.
Is there any way without a test like this that you can identify if your gut may be contributing to your allergies?
I mean, one thing that you can try on your own would be to eliminate certain foods that might be triggers. And like you mentioned, dairy is usually a big trigger for patients because in Chinese medicine, it does create a lot of mucus, but it also becomes very inflammatory because as all this gunk builds up, it provides less good flow and it creates more stagnation. Stagnation creates heat, which creates inflammation. So, that's why acupuncture is so helpful with treating allergies, but a lot of times we want to get back down to the source of where this is coming from. So like I was going through diet, sometimes it could be dairy, sometimes it could be certain grains, processed food, sugar, things like that are all very inflammatory. So, just in generalities, you want to reduce those inflammatory responses in order to help heal your
So eating less
allergies.
Inflammatory foods.
Yes.
Yeah, which really most people should do anyway.
Right. Yeah, because if it's not causing allergies, it might be causing something else that you're
No,
dealing
it's true. It's totally true. And really, it's unfortunate, but so many of us have very inflammatory diets. And I would say right now, people are probably not being as careful as they could. So maybe if you need a little motivation, that can help you out. We wanted to include to help with allergies this is something that acupuncture and herbs can treat really well. I treat it all the time in my clinic. And certainly there are herbs out there that can be really good. Generally, it's better to have more personalized recommendations, which is something we do with our patients. But I am going to go over some very helpful acupressure points that you can do for yourself to help open up your sinuses and relieve your sinus congestion in this next clip.
Hi, I'm going to show you some acupressure tips today that are very helpful if you are dealing with allergies, frontal headaches, and sinus congestion and pressure. We're going to start with points on the face. The first point I'm going to show you is very commonly used with needles in clinic, but also very helpful to help open your sinuses up at home with acupressure. The way you're going to find the point is go to the end of your nostrils, then take the fingers out just a little bit to this area here, which is known as the nasal labial groove or your smile lines. So follow that out and then push upwards. And you'll notice as you push upwards, you'll feel your sinus bone. Now, clearly you don't want to push so hard that you give yourself a bruise, but you do want to feel some sensitivity if you're in the right spot. And then you can just do little circles, you can hold pressure. It's up to you for how long you want to do it. My suggestion would be to do it for maybe 20, 30 seconds, stop, do it again. Or do those points, the ones I just showed you, large intestine 20, and then go to some other points, go through this whole routine, and then start again so that you are continually stimulating the points in a sequence. The second point that I'm going to show you, which is also very helpful for sinus pain, inflammation, and congestion, is stomach 3. The way to find the point is if you're looking straight ahead and you were to look at yourself in the mirror and look at your pupil, draw a line straight down from your pupil and right around under your cheekbone is where that point will be. Clearly it's a little different on everyone, but again, if you push in, you will feel some tenderness, and it's a good idea to rub that point as well. Again, we would do it bilaterally, unless of course some people, they do have more inflammation on one side. Feel free to do a little more on one side or the other if you'd like to. The next point I'm going to show you is urinary bladder 2. That point is at the end of the eyebrows, also very good for helping with sinus congestion and relieving tension in the area. It's an area that a lot of people, they squint and they tighten those muscles, so it can feel good to put pressure there. You can either take your index fingers, go to the end of your eyebrows and either push up or use a little bit of the body weight from the head. Personally, I like to use my thumbs. I'll put my elbows on a table. I'll lay my forehead into my thumbs right at the ends of my eyebrows, and then just let the pressure of my head do the work. Sometimes I'll move my thumbs around a little bit, but that point feels good a lot of the time and will also contribute to helping relieve your allergic symptoms. I want to show you one other point, which is on the hand, called large intestine 4. Now, a big caveat for this point is if you are pregnant or suspect you are pregnant, do not use large intestine 4, the point I'm about to show you. To find large intestine 4, it's a point right here. See how my finger's going up and down the bone in my hand, just under my index finger. You're gonna go to the middle of that bone, slip off the side, and kind of almost press in a little toward the bone. That is the point. It should feel tender. If it doesn't, move around a little till you find a tender spot. This point is particularly good for frontal headaches, especially like if you have a left-sided headache, do the right hand. If you have a right-sided headache, do the left hand. Also for sinus pressure, it's one of the most powerful points on the whole body. So I hope this has been helpful. Be sure to contact me with any questions or suggestions. Take care.
This has been great. Thank you so much. I look forward to doing more of these with you. And we will talk again soon.
Sounds good. Thank you. I appreciate it. It was a lot of fun.
All right. Talk to you
All
soon.
right.